people in our society who are struggling with the same exact symptoms that veterans struggle with. I mean, everyday people are walking around with trauma. The grief counselor, the person who like specializes in grief, the benefit to going to them is they actually can put a lot of language to what you're feeling.
Hey, have you ever found yourself maybe wondering about or considering therapy and maybe you've never done therapy before and you're a little anxious or you don't really know what to expect or even how to go about finding the right therapist for you? Well, I never had the benefit of therapy, unfortunately, but I reached out to an expert and I asked him some questions. And I have to tell you, I was blown away by what he had to say. Let's watch. Hey, Craig, it's so great to see you. Thanks so much for taking a little time with us today. Why don't we just start out? You tell me a little bit about yourself, maybe share, who you are, what you do.
Sure. Thank you. Thank you for having me. It's a pleasure to be here. My name is Greg Cintron. I'm a licensed marriage and family therapist. I am also an EMDR provider. For those who don't know what EMDR is, it's a eye movement therapy. So it's a little bit awkward, but it's very effective. And we use it for trauma. So if you kind of look up EMDR, eye movement desensitization reprocessing, you'll find a lot on it because celebrities use it. I mean, it's kind of it's an interesting thing, but I've always used it for trauma. So helping people kind of take away the trauma attachments or the symptoms that come with trauma by going back into their memories and kind of rewriting their memories. So it's a very interesting kind of thing.
Really? I
Yes,
think
it's
we're,
very
I hear another video coming.
yes, you could do a
I've
whole
never
nother
heard
video
that.
about
That's
that.
so
Yes,
fascinating.
it's very awkward to some degree. So like when people get trained in EMDR, a lot of people will not practice doing it because you're not doing a lot of talking. So your eyes are moving back and forth like when you're in REM sleep. And so your brain is way more active when you're sleeping. Your body's at rest. Your brain is a lot more open. And then they're thinking through these memories, not reliving them, just thinking through them. And so there's a lot of just, I stop the light bar, I check in with them, and they go right back to the light bar. But at the end of the day, in one session, it can take away. I mean, I have a lady who was agoraphobic, never left her house. And she did one session. And after 40 years of going through therapy, in one session, she was able to leave her house every day. It was like a miracle. And what was
Wow.
even crazier was I had only done EMDR like 3 times at that point. So I was just like, wow, this is really cool. It works. So I've started really practicing
I
with
can
that.
see
And it,
why you decide to go down that road after that
yes,
initiation with
right,
her.
right. And I mean, the best part for me is just people who have significant trauma. They're some of the best people I know, right? So
Oh,
they're kind of the people you want, the good people in the world. It's like
yeah.
I want to alleviate that stress that, those things in their life. And so in talk therapy, I get a lot of satisfaction from growing and walking with them and getting to know them. They teach me a lot, I teach them a lot.
Hmm.
But with EMDR, they get better in like, 1 to 3 sessions, and it just depends on like how complicated their issues are, but they find relief. It's not like a night and day difference. Like they're like, oh, I'm so happy, I'm going to go win the lottery. It's more of, I still remember the person who passed away, but I don't have the panic attack that comes with it, right? I don't have the shame
Wow.
or the fear or the guilt or any of those things. I just have an opportunity to move forward with either honoring this person or whatever they decide to do. It's kind of up to them. And then while working in the government, I kind of felt led to go into private practice. It scared me to death because I would be leaving the government just shy of a pension, losing all my health insurance and all those kind of things. But I really felt like I I don't know. I felt like this passion, kind of like how you are with this. It's your passion. So
That's
then
a fashion,
you
yeah.
almost move into this, you know, selflessness in that you actually, to your own detriment, right? You're going to move in that direction, right?
Yeah.
And so that's kind of what it was for me. I just kind of was like, okay, I'm going to take this leap of faith. I did it, and then I found that there are just so many people in our society who are struggling with the same exact symptoms that veterans struggle with. And so it's
Wow,
easy,
really?
right? So it's easy for the veterans to say, oh, I just came back from war and I have all these problems. But I mean, everyday people are walking around with trauma. So I found it to be really satisfying. I still work with veterans, but now I work with everybody,
With everybody.
basically. Yeah, and so
Wow.
it's been very fulfilling. So that's kind of who I am. I'm working in private practice. I work for a place called Heart to Heart Counseling, and it's in Osprey, Florida. Um, and I've been there for about 2.5 years now, and I love every minute of it. I
Wow,
just
that's awesome.
love doing what I'm doing. I feel blessed to do it. Yeah,
Well, what I wanted to talk about today was since I never went to therapy or any kind of counseling. So, you
yeah,
know, on this channel, I share my experiences. This is what happened to me. I learned something from this, or this has really helped me. I'm all sharing my experiences, but I can't share anything about therapy. And I have
yeah.
seen a lot of people who swear that therapy just saved their lives. I mean, that they never would have got through it without therapy. So I wanted to bring you on and maybe just ask a few questions for someone
Sure.
who might be thinking about therapy and maybe has never tried therapy before and doesn't know what to
Hmm.
expect or how do you find a therapist. These are kind of some of the questions that I had in my
Right.
mind. I didn't have anyone that would be recommended to me. So, I mean, do you go on Google? Is it like finding a dry cleaner? Do you, are there webs? I'm sure it's a little more, hopefully more thoughtful than finding a dry cleaner. Are there, is there, are there websites where you can go and maybe read reviews? Are reviews helpful? Is that even a thing? Or should they look for specifically a grief or I'm sorry, bereavement, as you call it, person? Like, give us some
Right.
insight what to do when you just have no idea where to start.
Yeah, absolutely. This field is one that it seems like only people in the field kind of understand what the lettering is behind persons' names and those kind of things. And so it's very generalized in a lot of ways. Yeah, if you're gonna, I've actually never looked up a dry cleaner, but I would I would assume it could be similar because with social media nowadays, a lot of people will say, "Does anybody know of a good dry cleaner
Mm,
in the area?" And I really think that word of mouth is probably the best way.
the best way.
Um, Right, because you never know what you're going to get. Sometimes you have people that look like amazing on paper, and then you come into the room and you realize they're all academia and
Yeah.
there's nothing really behind that. So, if you're the type of person that likes to have a lot of homework or handouts and those kind of things, then that might be the person you would want to go to. And then there are other people who just have a ton of personality. And so it's kind of a mixed bag. But if you have friends who know you and they see somebody and they go, this person's great, well, then that's probably a good place to start. But if you're in a very, like some, rural area or something to that effect, then I would move into the community. I would call hospitals,
Mm,
or places that do hospice because they would have good recommendations based on, grief and loss and who they go to, who are
that's
the people
true.
that they trust. Right. And so it's not necessary to, go, I need somebody who specializes in grief, but there are some real benefits to that. So if you're going to, like for myself, I don't advertise as specific to grief counseling, even though I did it for about 12 years in the government. Um, there are overlapping things. Working with trauma, I automatically work with grief. So, and then there are
Right.
other people who will say, they don't want to advertise just for grief because they don't want to have a full caseload of just grief because
Mm,
it's very hard on them over time.
right. I can see
But
that.
then there's people. You're right. And then there's people who specialize in like emotionally focused therapy, EFT. Well, EFT is excellent for grief. So they may not use it specifically for grief, but it can be applied to grief. And then there's acceptance commitment therapy, which is ACT. Uh, and that's another just modality that is amazing for grief. So if somebody can't find a grief therapist and they look for an EFT therapist or an ACT therapist, well, that's somebody I would pick over somebody who's just, a general practicing kind of thing. The grief counselor, the person who like specializes in grief, the benefit to going to them is they actually can put a lot of language to what you're feeling, right? So they can make it very measurable, and they can kind of articulate like this is where you're at, right? You're in the denial stage or you're in the anger stage. They're also prepared to hear your story. So a lot of just, regular therapists who maybe are meeting with somebody for the first or second time, what you'll get from them many times is they'll hear your story and they will fall apart, right? So they'll start crying
Oh,
themselves because it's so hard
wow.
on them, right? And so they think this is empathy, but oftentimes the person coming in does not need that. They need somebody strong enough who can handle their emotions. So that's why it's probably better
Wow.
to move towards somebody who specializes in grief. But if you're not going to be able to find that right off the bat, then go to the community, hospitals, different groups that might meet. You can do like, social media search. But then still, if you're having a hard time, then you want to move towards somebody who works with like relationships, that emotionally focused therapy, or acceptance commitment therapy, or somebody who works with trauma, because obviously trauma is
Loss
trauma.
is a trauma.
Right. It's a problem, right?
I
Yeah.
mean, it's a pretty big trauma. It's very,
It's a huge trauma, and it's complicated, right?
it's
So
a
like when
very
you're working
complicated
with
one.
post-traumatic stress, in the simplest of terms, it's like somebody gets into a car accident. They can associate cars with a trigger. They have a panic attack when they're around anything, related to that specific event. Well, loss of a person is specific to relationships all around. So, I mean, it affects every aspect of life. And then it's timeless, meaning that you can be affected 20 years later. So it moves towards more of like a complex post-traumatic stress. And so that's, yeah, it's not something, in some ways I would say the trauma doesn't go away, you mature with the trauma, right? The trauma is a
Yeah.
journey and you're growing in that journey, right? And it's kind of like, refining gold. You're in the fire and it's burning away the impurities, and what it's producing is gold. But while you're in the fire, you're just like, I don't know if I can bear this. I don't know if I can
Right.
handle this. Right. And
Right.
that's why therapy is really helpful. So I always tell my clients, when they're brand new, and first I tell them that I'm weird because I feel like it's important for them to know that. Right. So whatever comes out of my mouth next, if they're like, what? I didn't expect that. I'm like, well, you were warned. But I tell my clients, if you're on my couch, then I have your back. Right. And I think
Wow.
that's what people should expect when they see a therapist. They're not walking into the principal's office for that person to judge them. What they're doing is they're getting a person who is going to commit to going through this lifelong journey with you, and they have your back. Right. And so that them having their back doesn't mean they're not going to encourage you to grow or
Right.
point out when you have faulty thinking. But no, what it means is they have your best interest in mind. You can have a back and forth conversation with them. Like you can tell your therapist, you're way off base. I need you to come back here. And the therapist will do that. But they will follow you in your journey. Right. So everything is within boundaries, of course.
Mm.
But I tell all my clients, like, if you're going through something, text me. I won't probably answer all the time because I'm busy, but I want to know what's going on in your life in that moment, right?
Wow.
So by the end of the day, when I go to bed, I might have like 30 text messages from clients, and
Oh
I
my
read all of
gosh.
those text messages because
Wow.
I am walking through life with them, right? And when
Wow.
you're a trauma therapist, you should expect that your clients have anxiety, right? And I want to be able to address that later when they come back in and say, hey, how did this go? And they always tell me, like, you have an excellent memory. And I have a terrible memory. The difference is we're in some ways, right? We're kind of friends. Like, I know
Yeah.
therapists will get mad at me for saying that because of the whole, whatever. But at the end of the day, you care about people and you
Yeah.
want to help them through these issues. So you kind of want to know what's going on in their life. And that's kind of what you should expect by going to a therapist. And that's why some people will say, like, it's the best thing that's ever happened to me was
Wow.
just to have this person in my life who's there for me when I need them.
Hmm.
Yeah, so you're missing
That's
out. You
really,
should
yeah,
go
I
find
really
somebody
miss.
right now.
I don't need to. I just found you.
Well, it's
Boy,
funny. I tell people that I'm meeting for the first time that don't know me, and they'll say, "What do you do for a living?" And I say, "I'm in counseling." And I say that on purpose that way. And they go, "Oh, okay." And they're like, "So what do you do?" And I'm like, "I'm a counselor." And they're like, "Oh, I thought you said you're in counseling." And I always tell them, "I am in counseling. I go once every 6 weeks to a counselor, right? I have been for a long time, but I'm also a counselor, right? And
wow.
so it's kind of like, the hair club for men.
That's,
I'm not
yes.
I'm not just the CEO, I'm a client, so I
Well,
can
it's kind of
endorse
like the
it.
dentist. Somebody's got to clean his teeth too.
That's hopefully he's got clean teeth, right? Yeah. Yeah, it's
That's,
somebody going through life with you and having the wherewithal to put the like for me, I continually am just learning and educating myself. And I do it not really because I love school. I do it because I love my clients and I want them to have the best possible, answers that they can have to move forward. And so that's kind of what you're paying for. You're paying for somebody, right? In the hour, you might go, wow, that's really expensive, kind of thing. How is this guy getting paid $75 an hour or, $100 an hour on 150 or whatever? But the thing is it's all the hours that you're not right there in front of them. They are working.
mm,
And so it kind of it pans out, right? And so, but that's what you should expect. You should expect a very empathetic, kind, calm person who can handle what you've been through and will wait for you, but will also push you, right? Push you gently, sometimes not so gently, but will like push you right towards moving forward. And so that you don't get stuck with the bondage that comes with,
right.
that slippery slope of depression and all those other things. Yeah.
And it's so easy to get, those thought loops. Like it's,
Right.
it literally is like a broken record, and somebody needs to, like nudge it with their elbow.
Right. Yeah.
Get it
Yeah.
down that
Sometimes
road.
I
It's stuck.
right. When I hear people talk about what they're depressed about, I oftentimes will tell them, if you really think about all the bad things that are going on in the world, I mean, it might be normal to be depressed, but you have a choice. You can also factor in all the good things and at least have a more honest
Balance.
look, right? Because it's not all bad. And so you can't,
Right.
there's a lot of people that are just like, be positive, be positive, be positive.
Right.
And I kind of chuckle because I'm like, well, do that, but do it honestly. Don't be
Right.
positive so you write off somebody's emotions on things because they want to express how they feel,
Yeah.
right? Because we're going to be positive. No, let's just be honest. There's plenty of beauty in the world, right? You really can't experience true joy without knowing what suffering is. You have to have that
That's true.
contrast. Yeah,
That is so true. That's,
right,
I think a lot of people don't come out of their grief,
right.
especially with a child. Somehow the rules,
Yes.
to me, the rules are different when you lose a child. People,
Yeah,
if it's a parent or a grandparent, there's like it kind of goes through its course. But with a child, I
right,
feel like it's pretty well accepted. People just think, oh, you can never really heal from it. And that
right.
bothers me because
Yes.
I don't believe that. But it's so complicated because there's a level of shame and
Yeah,
guilt, or they feel like they wouldn't be honoring their child if they got better.
right.
It's so complicated.
It is very complicated. I have I have several clients who have lost their children to pool drownings,
Oh.
and several clients who have killed themselves because they lost their child to pool drownings. I have clients now who I have the utmost respect for that I've been working with for the past probably year, who lost their child to a bathtub drowning. And
Oh.
so it's so complicated, right? As I talk to them and everybody is home and this child, from what I think happened, is he was taking swim lessons and he was practicing possibly holding his breath underwater.
Oh.
And so, I mean, this is a family that goes through, I mean, the hardest thing is just waking up every day and moving on to the next day. And you're right. The mom, she kind of had this rule, right? Like, how can I enjoy life again? Or how can I be happy with this occurring? But I can tell you, this husband wife who's been coming in, the work we've been doing is probably the hardest work that I think I've ever put anybody through. Um, and I found myself, I kind of joke that with my clients, like, don't worry about offending me, right? I'd have to have feelings for you to be able to do that. Or I kind of just joke like, you'll never see me cry, but it's only because I have no tears. And so I just kind of do this macho joking thing with all these very serious topics. But I've done EMDR with him twice, and he did it mostly so his wife could see it and do it herself eventually. And then she ended up doing it, and we've done EMDR maybe 3 times with her. And while the light is going, there's really not a whole lot for me to do but watch the person, or draw pictures of Batman on my notepad or something like that, right? But I can tell you many
Wait, how
times.
much an hour? No, I'm just kidding.
Yes, that's right. Yeah. But I can tell you many times listening to her on the inside, I just found myself crying out to God, like going, please heal this couple. Like, it was killing me on the inside. That's never really happened to me before. But when I'm hearing all the intricate details, I mean, very specific details, and I know who these people are, I know their personalities. I'm there, I'm right there with them. And it's just, I mean, it's overwhelming. So I mean, even they're in such a better place. I mean, 100% better place than they were, a year and a half ago when this happened. Um, but it's amazing to me. Like, it still affects me. It's not even my child. I've never met this child, right? But I almost feel like it is my child. And so when I watch them have the courage they have, I mean, they come in, when they come in, we laugh more than we cry. But both happens every session. Every session both happens, but there is way more laughter, and there's a hope. And it's brought the family so close together that they care more about each
Wow.
other than anything else in the world. So now the work home life balance becomes complicated, because to some degree it's like, I don't want to go to work. I want to be here with my family. And so they've
Wow.
had to move into a family business. So the dad still works, but he's got this other, company basically with his wife and his 2 other children, where they make, different things and barbecue sauce and all that kind of stuff. And it's for them. Nobody knows why they do this. It's for them. But see, there's that light at the end of the tunnel. I mean, it's really there. And the joy is so much bigger after you've been through something so difficult. And we don't really want to forget what happened. We
No.
want it to mean something. We want it to, be with them in such a way that they can really honor, the joy of their child, the happiness, the life that they gave him, all of those things. There's just too many great and wonderful things that can be overwritten or rewritten by just the last moments of somebody's life. And so the
Yeah.
last moments of the life it just doesn't get to, right? We're not going to give the last few moments the power to overwrite,
To-
completely overwrite a lifetime.
Yes. Wow, that's perfectly said. That's going to
Yeah.
be a clip that I probably put on another video somewhere because that's really, really powerful.
Yeah. Yeah. Well, it is. That's the complication though, right? You have to walk through the complicated things to see the beauty in it. You just
Yeah.
have to. You can't ignore it and say, well, let's not talk about that, or whatever else most people say, right?
Right.
They say it's been 2 years. I think, well, 2 years in a lifetime is not a long time,
Yeah.
right? It's going to be your whole life. You
Yeah.
should just, right? I mean, this is something that you kind of have to accept because it happened. If we're going to be honest
Right.
with ourselves, well, then we kind of, these rules, like you said, the rules are different, right? When something unnatural happens, like you lose a child, right? Well, then the rules, like when you lose a child, it's more so, it breaks all the rules that you had before.
Yeah.
It destroys all of your
The-
foundational like truths that you thought you had, that bad things can't happen to good people, or if I make the right decisions and choices, well then I should see some fruit from that, or the my expectations of what the future looks like is me, my child taking care of me to some degree, right? Those
Right.
kind of things. And so all of that has to be kind of reassessed, or you let go of it kind of all, and you just are basically mindful in the moment, right? You just taking one day at a time. You're looking at the grass and look at the back of a leaf really closely, right? You start to realize like this world is way more whimsical than I had ever noticed before, right? And so
So
now all of a
interesting.
sudden you have reason to kind of get out of your head a little bit.
Yeah. That's the
Yeah,
thing. Get out of your head a little bit.
right.
But it's hard. It's very hard.
Absolutely.
It's definitely hard, but it's a
Yeah.
choice.
Right. Well, and that's why I think you really need to surround yourself with people who aren't kind of caught up in the rat race, right?
Right.
You need to like believe in magic again, right? You
Yeah.
got to look at like hope and see the rainbow and go, why is there a rainbow? Right? Like you have to kind of just open up, because otherwise what trauma does is it isolates people. The
Yeah, it
body
does.
has an impact of everything that's happened, and the skin is the largest organ, and it has receptors. It's like reading everything that's going on around you before you ever even think about it. And so to a large degree it's saying, I am never going to get let you get hurt in this way again. And so it starts to perceive a threat, and you kind of move like closer to home, right? And then it's like, well, I can't really trust what's out there in the world, so now I stay home. Well, I really can't trust, what happens on the TV. I move into my bedroom, right? Before you know it, you're in your closet because you can control everything in that closet, right? But then you miss out on everything in life.
Yeah.
The life key continues, and you're in this place where you feel like you're safe, but you're
Right.
really not safe. You see, if we actually open up the brain and we're thinking with a more fully functional brain, we don't have to worry about perceived threat. We'll see threat, we'll know what it is, and we'll be able to react or have a plan to that. And then we can trust that plan. So it's like getting your house robbed. You get your house robbed, or somebody gets their house robbed in your community. Then you notice cameras go up, an alarm system, they have a dog, and they have 25 weapons in their house. The burglars are not going to rob that house again, right? It's just not going to happen. But if the person is sitting in there and they are having a panic attack, well, then they're not actually trusting in any of the defenses that they have. And then that's a
Right.
sad story. But if the person's in there and they're, on a hammock out on their lanai and they're enjoying life because they're like, hey, I'll worry when the alarm system goes off, or I'll
Right.
worry when the dog barks, right? But I can rest in that. That's kind of where we want to get people to, right?
Hmm.
We want to get them to a place where they can relax, but they can still get up and go honor, right, the person lost. They can still get up, but it's by their choice, right? We give the freedom back to them. We're not going to
Right.
let the evil in the world take over, right? Or the perpetrators take over, right? No, we're going to build up as a community, come together and take care of each other. And that's kind of what we do in therapy, like on a microcosm.
Hmm. Wow.
Yeah. I know it's
Wow.
a lot. I'm sure you had a question there that had nothing to do with that, but
I,
that's where
I
we
can't
end up.
remember my questions anymore.
Right. That's you're like, it was something about dry cleaners. I think we were talking about dry cleaners.
No, that was
Right.
really interesting. Actually, that made prompted me to have another question, but now I've forgotten it. So it's probably
Yeah,
good because we've
it'll
gone a
come
pretty
to
long
you.
time. I'll
Right.
text you. Now you can
Yeah.
one more text to your 200 at night.
That's right. Yes, yes. Feel free to text me. You have my number, right? I also, I mean, I tell my clients if they have any questions, they could always email me because, it's a little bit easier to write an email. And so I could share my email. My email is Greg, Greg, C for Cintron, which that doesn't help because Cintron sounds like it starts with an S, but it's C. That's my last name. Greg C. lmft@gmail. So
Okay.
yeah, anybody
That's
has any
awesome. I'll put
questions
that
or
on the
anything,
screen. So
right? Yeah, and of course, I mean, leave comments for the video, right? Leave
yeah, I
comments for
would
the
love to.
video.
I would love for people to put comments and ask questions down below. We'll have you back on. Maybe we'll try
That's
to
right.
narrow it. I thought I had narrowed it into a specific topic, but
Right. Yeah, I know. I
it
should have
did.
warned you. Right. I'm kind of a free flowing, person. But yeah, if they
But
if they ask their questions in the comments, we can go specifically over those questions,
yeah, that would
and
be
address
great.
those
I think they
people.
would. I think people would love that. I mean, I didn't know anything that you just said to me. It's pretty fascinating,
Know
and
where I am. Just
yeah,
contact me anytime.
that's wonderful. No, thank
Thank
you
you for
so much.
having
It
me.
was such a pleasure to hear all these things. I'm
You're welcome. It was a
okay. You
pleasure.
have a great day.
All
All
right,
right.
you too.
Bye bye.
Bye-bye.
Okay, I'm going to jump right in here with a little tiny bit of commentary because, first of all, I had never met Greg in person, and I was just so impressed with him, with his commitment and his sincerity. And honestly, I was really shocked when he volunteered his email address and invited you to reach out to him if you have questions. And I thought that was amazing. I'm going to say something here, and he might not like it. In fact, I hope he doesn't get too mad at me. But before we even started, I asked him, hey, do you do remote therapy? Because I thought, well, maybe some people will watch the interview and say, gosh, I like this guy. I'd kind of like to work with him. So he said yes. And I said, why don't we include a link at the end if someone wants to reach out to you and book a session? And you know what he said? He said, no. He said, I really don't want to do that. I want to keep this very heart centered. I want it to be informational. I don't want to turn it into some kind of promotional thing. Okay. Totally impressed by that. And I totally respected it. And now I hope he doesn't think I'm disrespecting it, but I was just so impressed with him that I'm just going to tell you straight out. If you reach out to him and you have a conversation with him, you think, gosh, I'd love to book a session with him. Just saying. Apparently, he does do remote work. Okay, I don't know anything about it. He didn't share that information with me. But I feel like I would be really neglectful if I didn't let you know that. When Greg introduced himself and he launched into what he does, of course, silly me, I don't know anything about therapy. I'm thinking therapy is people talking to each other. I don't even know that there are other types of therapy that have very specific techniques that are something other than talking to each other. And when he started talking about EMDR, I was completely caught off guard. I had no idea what it was, and I was really curious. So after we kind of wrapped up our first talk, I backtracked back around and I had to ask him a little bit more about this EMDR thing. So if you're curious too, I want you to know that I took his follow-up comments and I made a second video about it. And you can watch that video here.